in Alberta, we're the second worst in Canada. 31% of our adults have a hard time accessing immediate care. You're not doing that badly here in Saskatchewan, relatively. You're at 21%. So the point is, this is not a problem of money. The most recent budget in Alberta gave a year-over-year increase to the healthcare budget of 18%. Just like other provinces, Alberta spends over 40% of our budget revenues on healthcare, and we're well on our way to 50% if something doesn't change. And even worse is that despite all of this spending, in Alberta our healthcare system is collapsing, quite literally. Last week something extraordinary happened in Alberta politics. You don't see this all that often. One of our government MLAs, Sherman, he's the parliamentary assistant to the Minister of Health, or at least he was, and he was himself an emergency room doctor. In fact, even though he's been elected for the last 2.5 years, he's continued to pull a shift a week in the emergency rooms. He broke the strict ranks of party discipline, and he spoke up in the Alberta legislature about the true story of what is happening in healthcare in our province. And he started off by telling a story about his father. Let me just tell you this one to illustrate. His dad was admitted into the emergency department at a hospital in Edmonton, but he never saw an inpatient bed for 4 days. And then he didn't get to see a specialist, but then he got sent home. And within 30 hours of being sent home, he had a heart attack. He survived, but this is the 5th near-death experience that Raj's dad has had in an emergency room due to unacceptably long waits in our emergency rooms in Alberta, and he's not alone. A couple of weeks ago, a report was leaked to the press, and Raj, we found out afterwards, is responsible as well for having put this report together a couple of years ago. And it showed the conditions in just one of our hospitals in Alberta. Let me give you some of the examples in this report. Because there were no areas where pregnant women could be seen, they were actually doing cervical exams on pregnant women in open triage areas without privacy. There was a patient with acute pancreatitis who threw up 10 times in the waiting room during a 7-hour wait before receiving any care. There was a 91-year-old woman with a broken hip sitting there without the benefit of any pain medication, waiting, once again, more than 7 hours before receiving treatment. There was an elderly man who died of a brain hemorrhage after he died, after waiting for 3 hours in an emergency room without being able to see a doctor. This report that was released documents, in fact, 322 cases of patients with equally urgent and immediate needs not getting treatment and being forced to wait for hours and hours in emergency rooms. If you didn't know better, reading through this report, you'd think you were reading about conditions in a developing country, rather than in a province that spends more than any other province in the country, in a country that spends almost more than any other country in the world. As Dr. Sherman, though, told the legislature, he wrote a letter telling the government back in January of 2008, and he predicted an imminent death within 24 hours if something wasn't done about this. Nothing was done, and subsequently they calculated as many as 5 to 7 deaths occurred due in large part because of these delays, and at least 200 other near deaths also occurred because of this. And you may have heard that yesterday Dr. Sherman got kicked out of caucus in our government in Alberta because he stood up and gave this information and criticized the government's lack of action on this. We don't think that that's something you should get kicked out of caucus for. We actually think that this is exactly what MLAs are supposed to do, and we look forward to working with Raj to get more of this information out. But this isn't the only problem, and we may be worse off in Alberta than you are here because you still have regional boards, so you have a little bit of localized decision-making, whereas in Alberta, our government has decided to consolidate all services under a single government monopoly called the Alberta Health Services, or as we like to call it, the Alberta Health Super Board. The problem is that now we have a single central planning agency that is essentially the sole provider, the sole purchaser, and the sole evaluator of virtually all hospital services in Alberta. Now, it doesn't take a PhD in economics to realize that there's going to be a big problem with this. We in the Wild Rose take a different approach. We believe that the only way we can get an effective healthcare system is through decentralized decision-making, local autonomy, a patient-centered focus, and of course, competition within a publicly funded and publicly administered healthcare system. We're at a point in Alberta where I don't believe that Albertans are going to be fooled into thinking that all we have to do is spend more money on healthcare and we're going to get better results. That's not what's happening. The more money we spend, the worse the results we get. And the reason for that is because we're pouring money into a broken system. We have to fix the system if we're going to get better results. We, in fact, in the Wilders, think that campaigning on healthcare is going to be one of the most important issues that we have to fight on in the next election. And we've put forward a plan at the beginning of this year for how we would change the system to deliver the healthcare Albertans want and need when they want and need it. And I'll tell you a few of the principles because I think we're going to have a national conversation with this. And I would hope that as we have that national conversation, that those in Saskatchewan and those in Manitoba, where I visited yesterday, are willing to join in this discussion because we must. I think that what we're seeing in Alberta is really just the tip of the iceberg. I think other provinces are going through exactly what we're going through right now. The difference is our doctors have the courage to speak up about it. So first of all, what we're looking at is we're looking to European healthcare. We have to start looking at the healthcare systems that are built on the same principles as ours, but that actually work. And there are many countries like this. Several think tanks have looked at these European models, the Frontier Centre being one of them. CD Howe has as well, as has the Fraser Institute, where they have managed to preserve universality, and they're principally publicly funded, but they've eliminated healthcare waiting lists. And these are countries like Austria, Belgium, France, Germany, Luxembourg, Switzerland, Japan. Sweden is making great strides in transforming their healthcare system, and they have for the past 15 or 20 years. And also in the last few years, Great Britain's National Health Service has also made some great strides. The nice thing about these systems, as I mentioned before, especially with Japan, is not only are they able to deliver better performance, but they're able to do it at less cost than what we're doing here. The second thing I'd say is we're committing to operating under the umbrella of the Canada Health Act. And I think that's important because in the past we've seen Conservative politicians stand up and say, we're going to challenge the Canada Health Act, and then of course the unions get all agitated and the Friends of Medicare come out, and then politicians get panicked, and so they pass legislation that is worse than if they'd done nothing at all. So we're not going to make that mistake. We're going to operate under the umbrella of the Canada Health Act, which means a publicly administered insurance system and is also universal and comprehensive and portable and above all accessible. The nice thing is about these countries that I mentioned, the 7 countries that work, is that there has been an analysis done of the kind of things that they're doing which has caused their system to work. The Fraser Institute has put forward a series of 11 proposals that would allow us to move further in the direction of those kinds of healthcare systems, and 8 of these proposals can be done under the umbrella of the Canada Health Act, through doing things like activity-based funding, through doing things like having medical savings accounts for non-insured services and for long-term care, through having P3s where they make sense, public-private partnerships, through having smaller, specialized surgical centers operating outside the expensive hospital environment, through taking off the caps on medical school enrollment, so we actually graduate enough nurses and doctors to be able to meet the needs of our local population so we can stop poaching them from Saskatchewan and from South Africa, through creating a robust primary care network. Because if a person doesn't have a family doctor, where do they go when they get sick? Well, they go to the emergency rooms. That's why our emergency rooms are clogged up. And through accountability, this is absolutely key. Let's look at the best practices and what is working at the highest performing hospitals and make sure those best practices get shared across the system. And then let's also make sure that the lower performing hospitals are brought up to standard. These are very common elements in the systems that work. But I will just say a word about activity-based funding, because I think this is going to be the most important transformation we can make in our healthcare system. Right now we have, in most provinces, a system of block funding, which means we give a chunk of money to a hospital or a health region, and whether they treat 500 patients or 5,000 patients, it doesn't matter. They get the same amount of money. Under a system of activity-based funding, the funding follows the patient to the facility where they receive their treatment. And so what happens is that under a system of block funding, when a patient shows up, they're seen as a cost. Under an activity-based funding model, when a patient shows up, they're seen as a customer and a source of revenue. So it becomes in the interest of the local hospital administrator to change the way they deliver services so they can attract more customers, treat more patients, and earn more revenues. Now, I don't think that this is going to be a 100% fix for the system, but I think that this is going to go a long way towards building in the kind of incentives that we need to build in to make sure we develop a system that works in our province and hopefully elsewhere. But this is the kind of thing that you can expect to see from our party. We believe that this is what an effective opposition does. We can't just grouse about what the other guys are doing wrong. We also have to put forward our own ideas about what we think that a government should do to get it right. And the fact that we talk about these ideas and that we talk about our solutions is, I think, why more and more people are taking a closer look at the wild rose, and why I think more and more people will continue to join us. Our intention is to act like a government in waiting, because that is our intention, to form government. Because in Alberta we do not elect oppositions, we elect governments, always. As David said, every so often there are these seismic shifts in the political landscape in our province where we stand up and say to the government in charge, you've lost your way. And we create a new party as a new alternative with new ideas and new people who can come in, sweep the old group out, and do what so badly needs to be done. The Wild Rose was developed to be a right-of-centre option to the Stelmach PCs. We were created in response to a void in the political spectrum. And now we believe it's up to us to change the direction of our province, and if we're successful, hopefully help start an intelligent conversation across the country so that we can make some important changes at that level as well. And I look forward to your questions. Thanks so much for having me here today.